So this is, of course, the picture of the Commonwealth. And the first graphic at the top, paying attention to the key that goes minimal, that's in a gold, all the way up to high in a dark, deep blue, you'll see that the entire Commonwealth is either at the moderate gray level, mid-gray, or to the dark blue, blue-gray level. There is not a single place in the Commonwealth at the moment that's at low or minimal. And then if you look at the Northern Virginia transmission extent, it essentially is showing the pandemic curve, in a sense, the experience of Northern Virginia, that, you know, back in February, we were at low. In May and June, we were at a substantial level of transmission. Then it went down, and for a long time, we were at minimal, then had a spike approaching substantial, went back down, and once again, we seem to be approaching substantial. So this will be the the ways that can go. I'm hoping that we're going to go back down rather than getting too substantial, but we're getting closer. Next slide. And so these are some of the metrics that I've talked about before. Sorry for the shorthand, and I'll try to address all of the things. These are the metrics that BDH and the Northern Virginia health directors have looked at from the very beginning. So, for example, the daily case incidence rate, that's the number of cases per 100,000. We're currently at 14.5. The materials in the parentheses are the lower and upper bounds if they happen to have it. Something below 5 would be ideal. Being above 10, which is what 14.5 is not where we'd like to be. And then we look at how many days has that trend been, and it was increasing for 21 days. And the threshold to say it's either going up or down is if it does that for 14 days. So our analysis is that this trend has been increasing. The daily PCR percent positivity rate is what the rate is for Northern Virginia. So, and I'll show you where we are later, but for Northern Virginia, we are at 6.1%. The upper threshold is 10. Obviously, the lower one we'd like is 0. This has been increasing for 25 days. It goes beyond the 14-day threshold, so that's considered a trend that's increasing. The rate of outbreaks per 100,000, and what you have to realize is the definition of an outbreak is 2 or more cases of spread within the same person, place, and time. You have to have all 3 conditions. We don't usually say 2 cases in Arlington because that's usually not the case, but we want it to be the same geography, like the same location, and in the same place and time. And so that has been decreasing for 9 days. We haven't had reports of that, but the threshold is 14 days. You'd have to have 14 days of decreasing for it to be called decreasing. So this is considered fluctuating. The case percent among healthcare workers, this is an important value to see how well our infrastructure is able to respond to things, and they're doing infection control as well. Because if you saw a high case percentage among healthcare workers, you'd be worried about the healthcare system, especially the hospitals, about what sort of protections are in place and how many cases are there. So the burden is at 2.8%. Being above 5 would be considered to be poor in this circumstance. So fortunately, this has been decreasing for 18 days. It exceeds the 7-day threshold. It's considered to be a trend that's decreasing. Visits to emergency departments per 100,000. This is 4.1 rate, and it's been increasing for 20 days, which is higher than the 14-day threshold. So that is considered to be an increasing trend. The rate of COVID ICU hospitalizations per 100,000. We're at 1.4. Having a number below 3.5 is where we want to be. That's been decreasing for 6 days, but it's not been 14, so it's fluctuating. The percent hospital beds occupied, that's all hospital beds, not just COVID. We're at 77.3%. If you cross 90%, that's considered to be more concerning. This has been increasing for 16 days, but has not crossed that 90% threshold. And then hospitals with difficulty getting PPE over the last 7 days, we're currently at a value of 0. One hospital 7-day period having difficulty would be 1, and we would consider that a problem. We have had that happen once. We've been fortunate more as a region, but there are reports other parts of the country have had more difficulty getting PPE because this has not been dealt with in a uniform manner, in my opinion. Next slide.
Dr. Varghese, I think Mr. Karantonis had one question on the last slide, I believe.
Mr. Karantonis, what is?
This is just for me to understand the numbers and the metrics properly. Just clarification. So percent of hospital beds occupied, you said that 77.3% is the general occupation percentage of, and that doesn't only reflect ICU hospitalizations, right? Sorry, COVID-19 hospitalization. Do we have a metric about how many or what part of this is due to COVID, or even more specifically, how many ICU? What is the ICU bed availability for the increased COVID patients that are coming through now the higher incidence?
Sure. We do actually have some of that information. I did not put it in this because it hasn't exceeded those thresholds. And so the ICU capacity has been decreasing, as in the number of cases. So therefore, it has not been actually crossed. Some of the developments in treatment have led to improvements that ICU beds aren't necessarily as needed as before. The other thing that you'll learn with the hospitalizations in general is right now, we still have the governor's permitted elective surgeries and admissions for different conditions. So there's a lot of leeway there for the state to potentially take on cases if, unfortunately, the cases were to get overwhelming. Then hospitals either voluntarily or would be required by the governor to stop elective surgeries. So they would then turn the surgery beds into COVID-19 beds and the like. So, and this is the regular bed capacity. Each of the hospitals has a 20% capacity above that they haven't even exceeded yet either. So there's more play in the system. So that's why I just wanted to present all of that, and thank you for this opportunity to provide that information.